Hi, my name's Sophie and this is part 3 of the portfolio presentation assessment. The post-anaesthetic care unit nurse plays an important role in ensuring the safety of post-operative patients when providing a handover to the surgical ward nurse. Clinical handover requires effective communication between nurses to facilitate optimal patient outcomes. The potential for surgical complications or post-procedural complications that may or may not be related to anaesthesia makes the surgical patient vulnerable. Respiratory and cardiovascular complications contribute to this risk especially. Common respiratory complications include airway and respiratory obstruction, including aspiration, hypoventilation, pulmonary embolism, and pulmonary edema. Common cardiac complications include, but are not limited to, venous stasis, dysrhythmias, coronary thrombosis, and hypotension. Other body systems may also be adversely affected by anesthesia or surgery. Infection and hypothermia are common examples. Due to the threat post-surgery adverse events posed to a patient, accurate patient assessment and documentation will contribute to an effective patient handover, which will minimize risk. The PACU nurse is responsible for monitoring the patient's physiology and psychology immediately after surgery, according to Berry and Cohn's operating room technique. Patient assessment includes vital sign observation, activity level, and state of consciousness. Once patient safety has been established, patients are transported to surgical wards or other units to aid further recovery. The clinical handover between the PACU nurse and surgical ward nurse is a critical juncture in a patient's recovery and safety. Guidelines such as ISBAR, which stands for Identify, Situation, Background, Assessment or Actions, and Responsibility or Referrals, are effective in providing a comprehensive handover that can reduce the incidence of adverse effects. According to Kitney et al., a recent review of 31 post-operative handover primary research studies confirmed the association between handovers and adverse patient events. Their study uses a method to determine the value of handover, to determine improvement or quality of handovers that will reduce patient risk. Guidelines which structure handover are less likely to miss or confuse valuable information because the nurse is following a sequence of steps which will logically and comprehensively summarize key patient information vital to safety. This includes, but is not limited to, reaction to anesthesia, surgical site, patient history, vital signs, and plan of care moving forward. This is especially important in the handover between the PACU nurse and the surgical ward nurse, as it will minimize clinical deterioration and will help to identify or observe patient risk related to surgical complications or anesthesia, which are common and can be responsible for mortality and morbidity in the population. Effective handovers will facilitate optimal patient outcomes, and it is the responsibility of PACU nurses to identify key issues that threaten patient safety. Thank you for watching.